Well, thank you, Minister, for being here today. Now, nearly a year and a half ago, the expert task force on substance use health set up by Health Canada recommended that, quote, an expert committee should be convened within 3 months of this report to lead the design of a national safer supply program with the goal to increase access to safer supply for up to 1 million Canadians at risk of death from toxic drug toxicity, end quote. Now, the task force further indicated that such a committee could, quote, develop a plan for deploying an expanded health response with resources commensurate with those allocated to responding to other emergencies such as COVID-19, end quote. Now, your colleague, the Minister of Mental Health and Addiction, said in September, the government is moving towards a regulated, safer supply of drugs. However, it's unclear what work is taking place to make that a reality and stop the thousands of deaths we're seeing every year because of the contaminated drug supply. Have you engaged with the Minister of Mental Health and Addictions on how PSPC might support the development of a national safer supply program?
Thank you very much, Mr. Johns. And I know that obviously this is an issue of tremendous importance for our country, and you have been in the forefront of bringing it to our attention. Just to be clear, PSPC is the department that responds to requests from other departments for acquisition of products or services. And I'm not aware of any direct requests from either the Minister of Mental Health and Addictions or Health Canada or even the Public Health Agency of Canada to our department, which I think is the very specific question that you actually asked. Deputy, are you aware of any particular request on safe supply?
No, we don't have any. It would require the funding to be provided and the department to give us a specific requisition for the procurement services.
Yeah, so this is what you did with COVID, and it's disturbing to hear this. Canadians are dying and lives are being shattered every day because of a contaminated drug supply. Now, you responded to COVID in a very different way. Over 30,000 Canadians' lives have been lost. It's the #1 killer of unnatural death in my home province of British Columbia. And in my community, numbers are skyrocketing because of the toxic drug supply. And we know the leader of the Conservatives Party wants to double down on the failed war on drugs rather than listen to experts in health and law and enforcement and people with lived experience. But your government minister says that the approach to the toxic drug crisis is different. But you're sitting on clear recommendations from your own expert task force on substance use. You're in that cabinet. To turn the tide on this crisis, you need to move past the stigma and the failed status quo. Now, Minister, across the country, life-saving supervised consumption sites are struggling to meet the needs of their communities because of a lack of adequate funding. Has PSBC discussed with the Public Health Agency of Canada or Health Canada the possibility of bulk purchasing harm reduction supplies to help reduce operating costs for these services?
The answer to your direct question is no.
So Minister, I'm hoping that you're going to speak to your colleagues and ask them why. Why are they not asking you to supply a safer supply, given the magnitude of this crisis? Do you understand and see this as a health emergency that it is?
Mr. Johns, I commit to you, I will have that discussion with the Minister.
You are the procurement minister, so it is something your government's pledging is a top priority, but you're not responding like it is. And so